Hey, it's Anastasia with Hump Day Happenings. The question this week is actually more on a serious tone, and that question was, what is our role in identifying and diagnosing eating disorders? Tough answer. I've sent out a lot of emails, and for those of you doctors who are watching and responded, thank you. We've got a lot of work to do. You see, we're on the team of diabetics, and we've actually started to work with cardiovascular surgeons in heart disease and general physicians. As far as eating disorders, we're not quite there yet. There are dentists who work with treatment centers. Now, symptoms. Yeah, we can see the symptoms. Enamel erosion. That's where with bulimia, with purging, after doing that so often, it wears away your enamel, becomes fractured, becomes brittle. What happens then? General restorative procedures such as crowns. It could fracture off to the gum line, your tooth would be extracted, and then of course the options are a dental implant, something to replace that tooth and restore the function of your bite. We will see in 89% of bulimia patients enamel erosion within 6 months of the time they've started to have symptoms of this eating disorder. In fact, 24 million suffer from it, and 1 in 5 suffer from anorexia or bulimia. Now, how do we diagnose? We might want to sit down and have an informative interview with the patient. That being said, take 2 forms of documentation. First, visual. Make sure you take intraoral cameras. Enamel erosion, you can see that. We can take an intraoral photo of that or a still photo. Written documentation, very important. That should be in the software. Have you noticed anything different in the patient's weight, in the patient's, do they have dry mouth, cracked lips, do they have calluses on their fingers from purging? That would be with bulimia. What can we do to help them get their mouth healthy? Because what happens with anorexia and bulimia is their pH drops. And if they're at a high risk for caries or they already have gum disease, definitely things are going to be out of balance and much more difficult for them to rebound and get back to a healthy state. Now, according to HIPAA, of course, we can't contact a spouse or anything like that. And dental insurance, not quite there in assisting with treatment during the time for these centers. There are dentists, again, that work with these centers or clinics, so I encourage you to check that out. I do hope this helps you, and I look forward to a day where actually dentistry can help those who suffer with eating disorders. It's all about education, and it's all about prevention. Till next Wednesday, take what you learn, make a difference with it.